such as following cases for Prof. Alfredo Iondolo from Italy shows the real complexity of the bulb. We all know that more than 90% of the canal treated in our daily endodontics are oval in shape, which means that 35% at least of the canal will not be touched by rotary file during instrumentation, while you can reach more than 90% of the canal by irrigation. Therefore, irrigation is so important during instrumentation. So what is the objective of irrigation? We have biological objective of the irrigation and chemical and mechanical objective of the irrigation. Biological objective of the irrigation is antimicrobial. Chemical and mechanical objective of the irrigation is flushing, lubrication, dissolution, smear layer removal. So, the characteristics of excellent irrigation is stable in solution, low surface tension, low viscosity, high solubility, able to completely remove a smear layer, doesn't interfere with repair of pre-apical tissues, doesn't induce a cell-mediated immune response, non-antigenic, non-toxic, non-carcinogenic, able to disinfect dentinal tubules, has no adverse effect on physical properties of exposed dentine, has no adverse effect on sealing ability of filling materials, easy to use and apply, inexpensive. And it should be non-irritating to the periapical tissues, effective germicide and fungicide solution, prolonged and sustained antibacterial, active in presence of blood, serum, and protein derivatives of tissues. We have a lot of irrigating solution in field of endodontics like sodium hypochlorite, chlorhexidine, saline, and hydrogen peroxide. For all purposes we said earlier, except removing a smear layer, which can be done by ADTA or MTAD. Welcome to the world of sodium hypochlorite. The most arrogant of a choice used in endodontology is sodium hypochlorite because it's effective antimicrobial agent, excellent organic tissue solvent, excellent lubricant, bleaching action, and of course, inexpensive. However, it has some disadvantages, which is highly toxic, highly irritant, highly inflammable, unpleasant odor, doesn't remove inorganic part of a smear layer. We all know that smear layer consists of two parts, organic part and inorganic part. The organic part can be removed easily by sodium hypochlorite, but the inorganic part cannot be removed by sodium hypochlorite. It must be removed by ADTA or MTAD. Extrusion of sodium hypochlorite into preapical tissues can cause severe injury to the patient, and to avoid that we have to know a lot of things like type of needles which should be used during irrigation. Those are the types of needles used in endodontology during irrigation. A is flat, B is beveled, C is beveled and notched, D closed-ended needles but side-vented, E closed-ended needles double side-vented, F closed-ended needles multiple vented. In this slide you can see the needle gauge size. You can place the needle easily so near to the apex or so far away. The larger the number, the smaller the size. You can clearly see the difference between the 27 and 30 gauge in this slide.